Now, talking about important global health messages, here I am in DC, joined by Jeff Sturchio, who, as you all know, is the CEO and President of the Global Health Council. Jeff, great to see you. Okay then, Jeff, 2010 conference theme is metrics and goals. Why?
We thought it would be a timely topic for us to really focus on because here in 2010, we're just 5 years from when the Millennium Development Goals are supposed to be achieved in 2015. And there are a number of other goals and metrics that the global health community has been looking at. Universal access to prevention, care, and treatment in HIV. The International Conference on Population and Development 15 years ago put together a set of goals on integrating family planning and reproductive health into other aspects of global health. So it seemed like a very good time to do this, in addition to which the UN will be having a review of the Millennium Development Goals in September. The Global Fund will be having a replenishment in October. And this is also the time when the UN has put together a joint action plan on accelerating progress toward maternal, newborn, and child health. So for all those reasons, it seemed like a good plan.
Jeff, it's good that we have all these goals, isn't it? But you know, a lot of them are long-term goals, aren't they? And how are we actually doing against them?
Well, progress is uneven. I think there are causes for optimism. If you look at the health-related Millennium Development Goals, which the cognoscenti call MDGs 4, 5, and 6, those goals have to do with trying to deal with child mortality, maternal mortality, and infectious diseases and other major health problems. In the last 20 years, since we've been measuring child mortality, it's gone down by more than a third. So there are really many fewer children dying every day than died of preventable causes 20 years ago. But there are still more than 7 million children who die every year from vaccine-preventable illnesses or diarrhea or other causes. So it means there's still a lot more to do. And I think it's also the case with maternal mortality. Again, there have been improvements. For many years, more than 500,000 people, women, died each year of childbirth or complications of childbirth. And now we find that that number has declined significantly, but there are still too many deaths, and that's why the community's focused on these issues.
Now, when delegates actually arrive here this week, what's their mood going to be like? Are they going to be optimistic?
Well, there are certainly some causes for optimism, although in some of the goals, some countries are not doing as well as one would like to see. So it's hard to answer the question categorically, but I think that you'll find that the delegates here this week are coming from a variety of different perspectives from different regions of the world. We expect to have 2,000 people or so to debate these issues and to look at what progress have we achieved against these various goals, what still needs to be done, and most importantly, how will we get there?
Well, Jeff, thank you very much indeed for taking the time to be with us today.